Hello, it's Wednesday, July 3rd. It must be time for another legislative update from your North Carolina Medical Society. Bringing it to you a little early because of the holiday week and because we've had a shorter week at the legislative session, but still a lot going on. So the House has been essentially out this entire week. They've had skeleton sessions on Monday, and they're going to have another one on Thursday. But the Senate stuck around to really drive bills through to work on leaving some point in time soon. We're thinking maybe next week or sometime soon thereafter. The big news at the end of last week, leading in to all the discussions this week, was the veto of the budget that the Governor Cooper signed on Friday and sent back to the legislature. So everything is kind of on hold right now, waiting for the House and the Senate both to be back next week to figure out if a veto override is possible. That would take 7 Democrats if all the members of the House are there along with every Republican. That would take 2 more Democrats along with all the Republicans in the Senate if they were there in order for a veto override to occur. Otherwise, the veto would be sustained. We're not really sure. There's a lot of speculation about that, but it's just a wait and see sort of thing. For stuff that really did move this week, though, we've got a laundry list of health bills. The first one is what we told you about last week with rural hospital stabilization. Now, this is Senator Berger's bill. It finished moving through committee. It moved on the Senate floor. It actually received bipartisan support, and now it goes over to the House. And this is $20 million for struggling rural hospitals to get a partner and figure out how to become stable for the long term. We also had another certificate of need bill move. This is the Senate version that has changed multiple times we've told you about. Now it is more focused on process, the thresholds, and dialysis centers being removed from need for or requirement for certificate of need. Now, when they talked about it this week in committee, Senator Krovic said that they're doing pre-conference with the House, which that's an indication that there's really not agreement that the House wants to do what the Senate is doing, but they're talking about trying to figure out what to do. In addition to that, we had a big action alert go out this week, and that action alert was around House Bill 220. And I know it was a little confusing. This is a bill that kind of popped at the end of last week. We had to get an action alert out late. We appreciate everybody really engaging on this in the first 8 hours that it went out. We had a couple hundred emails just in the first few hours before the committee meeting yesterday at 10 o'clock. This bill included a provision that we've been referring to as Section 12 of the bill, and that would actually have created exclusive provider benefit plans. And these are new plans for North Carolina market. They are a federally approved type of plan, but they're new for the commercial market here, and the Senate is really pushing them for small business owners. The idea of this is that they would create narrow networks, or where they've been used in other states and in the federal marketplace, is to create a narrow network, so less choice for patients that would supposedly drive down cost. Now, what we've seen happen in other states is that it costs less for the employer, but cost gets transferred to the patient because those narrow networks don't always have the doctors or other providers that patients need to see. And when they go see someone that is out of that narrow network, 100% of the cost is on the patient. And that's something that we have a difficulty with. We need to make sure that patients have choice to go see whoever they need to see to make sure they get the care that they most need. Now, as we're moving to drive value, to improve overall healthcare costs, we want to lower costs for everybody. We realize that healthcare is too expensive. I think we've all been agreeing on that. But if we're going to do something at the legislature, if we're going to pass a bill, that savings should be for everyone and not just one group that's paying for healthcare. It should be for everybody, and we shouldn't be pushing costs to our patients. They are paying enough with increased deductibles and premiums and all the like as it is right now. All right, so that bill was taken back to Senate Healthcare Committee. That provision was removed in part because of the action alert that you participated in, so thank you again for that. And we're still in discussions about that right now. The senators have asked us to continue to have conversations with health plans and other provider organizations to make sure that we can figure out something that would actually do just what we're saying, work to lower costs for everybody. In addition to that, the North Carolina Medical Board bill moved. This is House Bill 228 we've told you about that would modernize the Practice Act for physicians and PAs and others licensed by the Medical Board. That bill moved through Senate Healthcare Committee this week also. It's scheduled to go before Senate Judiciary on Monday. Still has to go through Senate Finance, back to Senate Rules, and then to the Senate floor. So still has quite a ways to go, but we'll be pushing to make sure that bill gets done before the end of this session. Outside of the legislative session, we've had a couple of big things also happen this week. The first thing is that the deadline for the state health plan came and went. So contract requirements requirement for sign up for contracts was July 1st by midnight. And so if anybody had started that process by that time, even if they hadn't completed the application process, then those providers would be considered for enrollment on January 1st, 2020. We still don't know how many providers across the state have signed up. We don't know how many physicians individually or in groups have signed up, other than the press releases that have been released by the Treasurer's office so far. And that doesn't look to be widespread except in a couple of specialties. So we're waiting right now to hear about what that network is going to look like and whether network adequacy standards have really been achieved by the folks that have signed up already in order to start on January 1st, 2020. So we'll get you an update on that as soon as we can. On Medicaid Transformation, many of you might know, but the PHPs that did not receive awards from the state of North Carolina actually filed suit to stop the implementation of Medicaid Transformation. And last week, the judge that was overseeing that stay denied it, saying that they did not have a likelihood of winning when they went to trial, so therefore she was not going to approve a stay to make sure that Medicaid didn't move forward. So we are still on the plan for a rollout beginning November 1st and then again statewide in February. Now that is also based on that provision that we mentioned last week about whether the budget actually goes into effect by July 15th as well. So a lot is still questionable about whether we're going live in November or February or sometime after March. But right now, Department of Health and Human Services is moving forward. You know that they stood up a call center last week. Some of you have been participants in making sure that some of the systems are beginning to get to work, but we're still driving forward until we figure out something otherwise. So like I said, a lot going on this week. We are hoping to drive towards the end next week, and so hopefully this will be the last or next to the last update for this legislative session. We do expect that they will be coming back in the interim at some point in time. So our ending time for this session will really just be a break and not an end until after the primaries. So we'll be keeping you engaged at the grassroots level and giving you information so that you can be talking to your legislators back home. But until we know more, we hope you have a great 4th of July celebrating the birth of our nation, and have a good weekend. We'll talk to you next week.